They called her the temp. That was the kindest thing anyone said to her face. The fluorescent lights hummed their endless mechanical song as Rachel Torres moved through St. Michael's ICU in Denver with the deliberate invisibility of someone nobody expected to remember, her scrubs pressed with precise creases, her badge clipped exactly 3 inches below her collarbone, her eyes down when Dr. Mercer walked past her station at 6:02 a.m. on a Tuesday in March. He didn't see the hands. That was the first mistake. The ICU breathed around her, ventilators wheezed their rhythmic lullaby, heart monitors beeped their counted seconds, for pumps chimed soft reminders that fluid was flowing into veins that had forgotten how to ask. Rachel moved through this symphony like a musician who had played in orchestras most people would never believe existed. She changed dressings with an unusual precision that made the surgical techs pause and watch, though they never said anything. Her fingers found suture patterns that needed attention before the wound inspector's rounds. Her eyes caught infection signs in their earliest whispers, before fever spikes and before the sepsis alarm screamed its terrible announcement. A 22-gauge needle in her hand felt like an extension of bone and nerve, not a tool she was learning to use. But nobody noticed the hands. They noticed the apologies. "So sorry, excuse me. My mistake, doctor. I'll step aside." The words came soft and practiced, the voice of someone who had decided years ago that taking up space was a luxury she couldn't afford. Other nurses bumped into her in the hallway and Rachel simply shifted her weight, steadied the 4-pole, let them pass without comment. It was a performance that had kept her alive in 17 different countries, and it was working perfectly here in the climate-controlled corridors of a 5-story medical center where the most dangerous weapon anyone carried was a pen that could write a termination letter. The locker room was empty at 6:15 a.m. when Rachel opened her assigned metal cabinet and hung her jacket on a hook. The civilian jacket, navy blue, cotton blend, completely unremarkable. She touched the inside lining with 2 fingers, tracing the faded green beret insignia sewn there by hands that knew field medicine in the Hindu Kush, that knew how to work in dust storms and mortar fire and the kind of darkness that made you wonder if dawn was a myth people told to survive the night. The patch was nearly invisible now. That was intentional. She touched it anyway, the way someone touches a talisman, the way soldiers touch photographs of families they haven't seen in 3 years. The contact lasted exactly 2 seconds. Then she closed the locker and walked toward the ICU. St. Michael's hummed with its morning rhythm. The night shift was handing off to day shift, voices in the corridors taking on the cadence of tired people who had stayed awake through the dark hours and were now passing their burdens forward like relay runners passing a baton made of suffering and exhaustion. Rachel pulled up the assignment list on the unit computer. For patients. One would be hers specifically. She was already reading his chart before anyone told her his name. Colonel James Garrett. 53 years old. Green Beret. Medevaced from the Hindu Kush 72 hours ago with injuries that had made the army doctors use the word unsurvivable. Multiple trauma. Compound fractures in the left femur and tibia. Pneumothorax with hemothorax. Abdominal wall wound that had required reconstruction. He was breathing on a ventilator, sedated, his body wrapped in bandages like he was a gift nobody wanted to open. The chart showed 3 specialists had already assessed him. Their notes said the same thing. Recovery was impossible. He was a comfort care candidate waiting for the family to say goodbye. Rachel finished reading his chart at 6:52 a.m. She wrote nothing in the notes. She simply stood at the nursing station, staring at his name on the screen, her jaw lined slightly tighter than it had been moments before. A trauma surgeon walked past her without looking. "Morning, Rachel." The tone said, "You are not important enough to make eye contact." "Morning, doctor," she said, and the words came out soft enough that he probably didn't even hear them. Dr. Marcus Mercer arrived at 7:03 a.m. in a charcoal suit that cost more than Rachel's monthly rent, his shoes polished to the kind of shine that required professional equipment, his smile the practiced expression of a man who had learned that confidence could be worn like armor. He was 48 years old and had built a career on a simple principle: patients were problems to be managed, and the best way to manage problems was to make sure all the money flowed toward his own private practice and all the liability flowed toward anyone convenient enough to stand near when something went wrong. He had a system. It was elegant. It was illegal. It had been working for 8 years. The system required 3 things. First, a hospital with enough complexity that nobody asked too many questions about billing discrepancies. St. Michael's qualified. Second, a steady supply of patients who couldn't speak for themselves, comatose patients, sedated patients, patients whose families were too grateful for any sign of care to examine the invoices. The ICU was perfect for this. Third, a compliant staff who took orders without asking why those orders didn't match the standard protocols. Most nurses understood the unspoken hierarchy: ask questions and lose your job. It was remarkably efficient. But Rachel Torres was asking questions. Mercer had noticed. She had been at St. Michael's for 4 weeks and she had already flagged 2 of his phantom specialist consults, questioning why a neurologist had been called to assess a patient with a spine injury who had clearly required orthopedic consultation instead. She had pulled the chart on another patient and written a note asking why the attending had ordered a vascular surgery follow-up when the patient's ultrasound showed no vascular compromise. The notes were professional, polite, deferential. But they were questions, and questions were a problem. Mercer watched her now from across the ICU, pretending to review charts on the main computer while tracking her movements. She moved from patient to patient with an unusual precision. Her hands never hesitated. Her assessments went deeper than the standard vitals check. She was examining each dressing, each foresight, reading the language of wounds like other people read news feeds. When she inspected the femoral line on bed 4, she spent 47 seconds just looking, her fingers not touching anything, her eyes recording information. Most nurses spent 12 seconds on a line check. Rachel spent 47. She was dangerous. Not in the way that mattered to hospital administration, but dangerous in the way that came from actually caring about the patients. That was the kind of person who asked questions that couldn't be answered with bureaucratic language or deleted emails. Mercer walked toward her station at 7:41 a.m. His smile was present, his voice warm, the tone of a senior physician taking interest in a junior staff member. "Rachel, how are you settling in?" He was already reading her name tag, already knowing exactly where she stood in the hierarchy, already calculating whether she was the kind of person who could be managed or the kind who would need to be removed. "Very well, thank you, doctor." She turned to face him, her posture relaxed, her eye contact careful, not too much, not too little, the gaze of someone who understood that her place was a few steps down from his. "I'm learning a lot." "Good. Good." He leaned against the desk with the casual confidence of someone who had never been told no. "For weeks now? How are you finding the unit? The pace?" "It's fast," Rachel said. "But manageable." She was updating the 4-pump as she spoke, her hands continuing to work, her voice never changing volume or cadence. "Everyone's very professional." "They are." Mercer paused, letting the silence stretch for exactly 1 second, a manipulation technique taught in medical leadership seminars, designed to make people uncomfortable enough to keep talking, to fill the void with confession. "I noticed you've been very thorough with your charting. Detailed assessments." "I want to make sure I'm documenting everything accurately," Rachel said. The words were textbook compliance. Her hands never stopped working. "Of course." He smiled. It was the smile of a man who knew where all the power was held, and he held it all. Just remember, sometimes in a busy unit, perfect documentation can slow things down. We're here to manage comfort, to ease the transition. He let another pause settle. Not necessarily to pursue every medical angle that might delay the inevitable. Rachel's hands stopped moving. For exactly 1 second, they were completely still. Then she set the 4-pump settings, double-checked them, and turned to face him fully. When she spoke, her voice was the same soft register it had been moments before, but something had changed in her eyes. Something had shifted. Something had woken up. "Colonel Garrett is my patient today," she said. It wasn't a question. Yes. Unfortunate case. The family has been briefed on prognosis. Realistic expectations. Mercer was already moving back toward the hallway, secure in the knowledge that this young temp nurse had understood his message perfectly. She would slow down her assessment. She would accept the consensus. She would watch a salvageable patient become unsalvageable because asking questions was a luxury she couldn't afford. Rachel watched him leave the ICU. Then she walked to bed 7 where Colonel Garrett lay sedated, his chest rising and falling with the mechanical certainty of the ventilator, his full lines running with purpose, his body wrapped in bandages that were hiding something nobody else was looking hard enough to see. She pulled his chart and began reading every note from every specialist with the intensity of someone who had read medical reports written by people whose lives depended on being right. She was reading for the gaps. She was reading for the assumptions. She was reading for the moment when someone had stopped trying and started giving up. What she found made her jaw tighten a second time. What she found was going to change everything. The file Rachel found in Colonel Garrett's chart wasn't just incomplete, it was strategically gutted. 3 specialist consults deleted. Imaging flagged then unmarked. A vascular ultrasound ordered, then cancelled without documented reason. Someone had scrubbed his medical record like a crime scene, leaving just enough documentation to look legitimate while hiding everything that mattered. She photographed each discrepancy on her phone, then closed the laptop at 2:27 a.m. and touched the unit patch inside her jacket lining. The patch was real. Everything else in this hospital was a lie. By afternoon rounds, Dr. Mercer had already decided how the day would go. Rachel adjusted the wound vac on Colonel Garrett's leg while his sister, Margaret, watched from the corner chair where she'd kept vigil for 9 days without missing a shift. The room smelled like antiseptic and the faint metallic tang of drying blood beneath fresh gauze. Mercer entered with his entourage, 2 residents trailing behind like satellites orbiting a dead star, their tablets already open for whatever narrative he was about to construct. He examined the dressing with the deliberate slowness of a man performing for an audience, his movements theatrical and precise. Then he peeled back the edge of the vac seal and made a small dissatisfied sound, the kind of noise that turns heads. "This is completely incorrect." He didn't look at Rachel when he spoke. He looked at Margaret. "Did anyone review the protocol on this patient?" Rachel opened her mouth. Mercer raised his hand without turning. "Miss Torres here seems to think her online nursing degree qualifies her to improvise on trauma care." He gestured at the wound site. "Look at this technique, sloppy, contamination risk, frankly dangerous for a patient this critical. We don't do field medicine at St. Michael's. We do medicine." The words landed like surgical strikes, each one calculated to undermine, to diminish, to position Rachel as incompetent in front of the one family member who'd been advocating most forcefully for aggressive intervention. Margaret's face shifted, concern mixing with doubt. Doubt was what Mercer needed. Doubt made families compliant. Rachel took one measured breath. What came next happened in the space between heartbeats. A single tear traced down her left cheek, not a tremor, not a crumble, just one perfect tear that looked like pain and read like surrender. She wiped it without breaking eye contact with Mercer, her hand steady, her jaw working slightly as if restraint had a physical weight. The wound showed early dehiscence at 0600, doctor. Her voice was quiet, the kind of quiet that belonged in cathedral spaces. "I reinforced using the military field protocol for fascial separation because the standard closure was compromised. It's holding." The silence that followed had texture. Mercer's jaw tightened visibly, a muscle flex near his ear, barely perceptible unless you were looking for fractures in composure. He hadn't expected her to answer. He'd expected her to apologize, to shrink, to become smaller in that room. Instead she'd given him facts and a single tear that made him look like the villain in a story he'd written to make her the villain. "Military protocol." He said it like an accusation. Like she'd confessed to something criminal. "You're a temp nurse, not a field medic. Don't let her touch this patient again today." Clear. It wasn't a question. The residents nodded automatically, not looking at Rachel. Mercer left with the same theatrical precision he'd arrived with, his entourage trailing behind, but Rachel caught it, the way his neck flushed, the tightness in his shoulders. She'd rattled something loose in him. He'd wanted her to break. She'd given him professionalism instead, and professionalism in the face of cruelty looks an awful lot like courage. That afternoon, the write-up appeared on the unit board in the nursing station, a formal document printed on hospital letterhead, laminated and posted where every staff member would see it during shift change. Torres, improper wound assessment, insubordination, failure to follow chain of command. Mercer had typed it himself. Rachel could tell by the formatting, the aggressive spacing, the choice of words that sounded official enough to survive scrutiny but personal enough to destroy a reputation. The sheet stayed there for 8 hours before the charge nurse quietly removed it, but by then it didn't matter. Everyone had read it. Everyone had formed their opinions while reading it. The break room was the real execution. Rachel entered during the 15:30 shift change with her lunch container in hand, turkey sandwich, apple slices, bottled water, and found 8 veteran nurses at the center table. Nurses who'd nodded at her in hallways. Nurses who'd asked about her experience. Nurses who'd seemed, if not friendly, then at minimum professionally courteous. One by one, they stood. One by one, they gathered their coffee cups and their phones and their small personal items. One by one, they left without a word. The exodus took 90 seconds. The room entered like a building evacuation. Rachel sat alone at the table and opened her sandwich. She didn't eat it. Her hands were steady, but her throat had closed around a knot she wouldn't acknowledge to herself. This was isolation protocol, the kind of coordinated silence that spread through hospital hierarchies like infection. Mercer hadn't just told them to avoid her. He'd made it clear that associating with her was an error in judgment, a career liability. She was contagious. In hospital politics, contagion spread faster than bacteria. She closed the lunch container and left it unopened on the table. A week later, during a routine dressing change, Mercer engineered his next move with the precision of someone playing chess against an opponent who didn't realize the game had started. Rachel was prepping the sterile field for Colonel Garrett's debridement, instruments arranged with the exactness of someone who'd done this in field conditions where mistakes meant infection or death, when Mercer appeared in the doorway with the attending physician and 2 residents. He watched for exactly 30 seconds, his eyes tracking every movement, and then he moved. "Stop. Everyone stop." His voice had the edge of surgical authority, the kind of command that made people freeze. He pointed at Rachel's gloved hands, which were exactly where they should be, nowhere near the sterile field. Did anyone see that? She just contaminated the entire setup. Nurse Torres here just put this patient at risk for sepsis. The lie was so precise, so confidently delivered, that it created momentary doubt. The attending nurse looked uncomfortable but said nothing. The residents looked away. No one contradicted the doctor. No one ever did. Rachel's hands didn't shake. Her voice didn't crack. She stood perfectly still for 3 seconds, and when she spoke, it was with the kind of calm that comes from having already survived the worst the world could deliver. "I've maintained sterile fields under mortar fire, Doctor." She let that sentence sit. "Perhaps you'd like to review the technique with me." The room went so quiet you could hear the ventilator hiss in the corner, the faint electronic beep of the cardiac monitor, the sound of Mercer's breathing shifting from control to not. His face flushed, not the soft blush of embarrassment but the deep crimson of rage that couldn't find an acceptable outlet. He'd been challenged in front of witnesses. He'd been challenged by someone he'd been methodically destroying. Worse, he'd been challenged using his own vocabulary, technique, review, precision, the language of medicine itself turned against him. "My office. Now." The words came out clipped, dangerous. "We need to discuss your future at this hospital." As Rachel walked past him toward the door, she reached inside her jacket and touched the faded unit patch sewn into the lining. Her fingers lingered there for exactly 3 seconds while Mercer watched, trying to understand what that gesture meant, what it signified, why a temp nurse would touch her clothing like she was invoking something. He didn't know. He couldn't know. The patch was from the Hindu Kush, from operations he'd never heard of, from a lifetime that existed in the space between her civilian identity and her real one. She was a soldier in borrowed scrubs, and he'd just made the mistake of thinking she was someone he could break. The door to Mercer's office was expensive wood with brass fixtures, the kind of office that came with institutional power and insurance billing schemes and the ability to make phone calls that ended careers. Rachel stood in front of his desk while he pulled out a termination letter, pre-written, already signed, just waiting for the right moment to deliver it. But that moment didn't come. Instead, he slid a formal warning across the desk instead: insubordination, contamination protocol violation, unprofessional conduct toward medical staff. One more incident, Mercer said, and you're done. Understand? Perfectly, Doctor. Don't make me regret keeping you around. Rachel took the letter and walked back to the floor, where a surgical tech named Martinez was waiting with a full prep tray for Colonel Garrett's debridement. Martinez had 30 years in trauma surgery, the kind of quiet competence that came from having seen everything the human body could survive and having learned not to waste words on things that didn't matter. As Rachel assisted with the complex debridement, identifying viable fascia and tissue planes that needed separation, her hands moved through the procedure with a rhythm that made Martinez slow down, watching. She was running a specific suture pattern. Not standard closure technique. Something else. Something that required the kind of anatomical knowledge you only learn by doing surgery in conditions where complication meant watching a soldier die. That's a couple running stitch, Martinez whispered, staring at Rachel's hands like they'd just revealed something classified. You don't learn that in nursing school. Rachel's hands didn't pause. The needle went in. The thread pulled. The closure held. You're combat medical, aren't you? Martinez wasn't asking. He was recognizing. I can't talk about it. Martinez nodded slowly, then worked in silence, but something shifted in his presence. He began handing her instruments before she asked for them. He anticipated her movements. He worked with her the way soldiers work together, with a wordless synchronization of people who'd both operated under pressure where mistakes cost lives. They finished the debridement at 1847, and when they stepped back from the bed, Colonel Garrett's wound was clean and viable and holding, the kind of closure that would actually heal. Good work, Captain, Martinez said quietly, using a rank she'd never mentioned out loud. Rachel didn't correct him. She carefully removed her gloves, touching the unit patch one more time before leaving the surgical suite, and that was when everything began to accelerate toward something neither of them could stop. The formal warning letter sat on Rachel's locker shelf, crisp white paper with Mercer's signature bleeding slightly where his pen had pressed too hard. She'd read it twice in the break room without trembling, without the heat rising in her throat that civilians called shame. This was noise. Mercer was escalating because she'd touched something. She could feel it the way you feel a tripwire under your boot, subtle pressure, wrong angle, everything after this moment would move faster. Martinez was prepping the debridement tray when Rachel entered the surgical suite, instruments arranged in precise rows like ammunition. He didn't look up, but his movement slowed fractionally when she appeared. The surgical tech had worked 16 years at St. Michael's, long enough to sense when the air in a room had changed density. Colonel Garrett's vitals stable. Rachel's voice carried the careful flatness she'd perfected over 3 months, competent but deferential, a nurse asking permission to observe rather than someone who'd already made the diagnosis before stepping through the door. Holding. Martinez's hands moved across the sterile field, securing drapes. Dr. Mercer said we're doing routine cleaning, nothing aggressive. In and out. Rachel had already read the chart. Mercer's last note called the wound contaminated and necrotic, a textbook write-off. But the imaging told a different story if you knew how to read it: subtle shadows where blood vessels should have been patent, density changes that meant dead tissue wasn't the only problem. She'd seen these exact patterns in a forward surgical team at Bagram when a medevac had arrived with a femoral wound that looked superficial until you looked closer. That patient had lost the leg because someone hadn't looked closer. She began washing in at the sink, water running over her hands in practice motions. The smell of antiseptic soap mixed with something else, the metallic copper of old blood from the dressing changes, that scent you never quite forgot once you'd smelled it in a firefight. She closed her eyes for 1 second. Just one. Then opened them and approached the sterile field. "Let's reassess the wound depth first," Rachel said, not asking, the words shaped like a suggestion but carrying the weight of command. Her hands moved across the exposed tissue, and muscle memory took over, the kind that only lived in the bodies of people who'd done this under incoming fire, who'd learned to see human anatomy as a map of survival rather than a textbook chapter. She was 3 minutes into the debridement when Martinez froze. His hand stopped moving. His breathing shifted. He was staring at her hands, specifically at the running stitch she'd just placed along the anterior aspect of the wound, the technique so specific to one place, one theater, one war that it might as well have been a fingerprint. "That's a Kabul running stitch." His voice barely made sound. "You're combat medical, aren't you?" Rachel didn't break rhythm. Her hands kept moving, kept working, the motion uninterrupted even as every cell in her body registered that her cover had just developed a hairline fracture. She'd known it was coming. Surgical techs who'd been in country recognized the technique immediately. It was faster than conventional sutures, stronger under field conditions, and almost never taught in civilian surgical programs. Martinez had been a Navy corpsman. Kandahar. 2011 to 2012. Different training programs, she said, her voice level as a surgical laser. "I picked it up at a conference." But Martinez wasn't stupid, and he wasn't asking for permission to believe her. He was simply stating a fact he'd already verified the moment he saw her hands. He looked away, back to his instruments, and nodded once. That was all. One nod. One active witness that meant he understood something critical was happening to Colonel Garrett, something that required more than routine cleaning. Rachel continued the debridement with absolute precision, debriding the necrotic tissue layer by layer, her movements methodical and purposeful. But halfway through the third layer of tissue removal, she saw it. The pseudoaneurysm. A ballooning of the subclavian artery where the initial trauma had compromised the vessel wall, forming a pocket of blood under pressure that would rupture without intervention. Not visible on the surface. Not documented in any of Mercer's previous notes. The kind of finding that could kill a patient in a night shift when nobody was paying attention. "Martinez," she said quietly. "Tell me what you see at coordinates 3 to 4 centimeters anterior to the anterior scalene." He bent closer. His hands trembled once, not from fear but from recognition. From understanding that he was looking at a death sentence that nobody had documented. "That's a vascular injury," he breathed. "Expanding," Rachel confirmed. "The vessel wall integrity is compromised. When this ruptures, and it will rupture, the patient bleeds out into the chest cavity in minutes. No one monitoring him overnight will even see it coming." She finished the debridement with the precision of someone who'd learned long ago that the difference between saving a life and losing one often came down to millimeters. When the surgical site was clean and the wound lay exposed for final assessment, Rachel stepped back and began making meticulous notes in the patient's chart. Not the casual, abbreviated charting that hospital nurses typically used. Exact anatomical coordinates. Specific measurements in centimeters. Clinical language that described not just what she'd found, but the timeline of what would happen if the pseudoaneurysm wasn't addressed. Pseudoaneurysm of the left subclavian artery, estimated 1.8 centimeters in maximum dimension, located at the junction of the proximal and middle third of the vessel, she wrote, her handwriting precise and clinical. Vessel wall demonstrates focal point of compromise with surrounding hematoma formation. Immediate vascular surgery consultation recommended. High risk for acute rupture with hemodynamic instability. Intervention required within 24 hours. She added the timestamp. 0930 hours. She documented the finding as a critical discovery that required immediate escalation. Then she did what any good nurse does when they find something that could kill their patient. She submitted the note for the vascular attending to review, flagging it as urgent, as the kind of finding that changes everything about a patient's treatment plan. The note went into the system at 09 for 7 hours. Rachel could see it appear in the queue, waiting for the vascular surgeon's morning review. She'd done her job. The patient had a documented critical finding. The medical team would see it. They would have to respond. She didn't yet know that Dr. Mercer had access to the EHR at times when most attending physicians were still sleeping. That he'd been monitoring her notes the way a predator monitors a rival entering his territory. That in less than 12 minutes, he would read the urgent consultation request, understand exactly what she'd found, and recognize that her clinical documentation posed a direct threat to the billing scheme that had been paying for his daughter's private school tuition and the renovations on his Highlands home. The room around her smelled like antiseptic and old blood and the faint chemical tang of sterile saline. Martinez was cleaning instruments, moving with the deliberate focus of a man who had just learned something important and was choosing very carefully what to do about it. Colonel Garrett lay sedated and vulnerable, his wound finally clean, his pseudoaneurysm documented but not yet known to the surgeons who could repair it. Rachel peeled off her gloves and touched the unit patch sewn inside her jacket lining, the way she did every time she'd done something that mattered. The green beret insignia felt warm under her fingertips, like a heartbeat. Like something alive and watching. She had no idea that Mercer was already in his office, pulling her urgent consultation off the system, reading her note, understanding its implications, and reaching for his phone with the kind of cold focus that only came from someone who'd already decided to burn everything down rather than let it burn him. By 0600 Tuesday morning, Mercer's office was already dark except for the glow of his computer screen. He'd been there since 0430, coffee growing cold in a ceramic mug bearing the hospital logo, his fingers moving across the keyboard with the precision of someone who'd spent 20 years learning exactly where to look. Rachel's consult note had arrived in the electronic system at 0347, marked urgent, flagged for vascular surgery, detailing a pseudoaneurysm in the subclavian artery with meticulous measurements and timing. He read it twice. Deleted it once. Then he opened a new note in the attending physician's name, timestamped to appear as though it had been entered hours earlier, patient 2 unstable for intervention. Comfort care protocols recommended. Family discussion initiated. He sat back in his chair and smiled. The deletion would never appear in audit logs. The new note would stand as the official record. In 6 hours, a man would die, and the only evidence that Rachel Torres had ever identified the problem would exist nowhere but in her own mind. Mercer took a sip of cold coffee and returned to his billing spreadsheets. Everything was contained. Everything was controlled. At 0312 on Tuesday, the alarms shattered the quiet of the ICU like gunshots. 3 monitors shrieking in unison. Nurses bolting from the break room. Colonel Garrett's chest heaving against the ventilator as the pressure in his thoracic cavity mounted with each bleeding pulse. The pseudoaneurysm had ruptured exactly as Rachel's assessment had predicted, a vascular bleed filling the space around his lungs, drowning him from the inside. The attending physician, Dr. Patel, arrived in under 90 seconds, still pulling on gloves, eye scanning the monitor tracings as he moved. His face told the story, recognition, then resignation. Garrett's blood pressure was 68/34 and falling. The bleeding was massive. Transport to the OR would take 12 minutes. He wouldn't survive 6. Patel looked at the code nurse. Call the family. Tell them we're moving to comfort measures. This patient is too unstable for operative intervention. Rachel Torres was at home, 12 miles away, sitting on her bedroom floor with a laptop in her lap and the faded unit patch pressed against her chest. She monitored Colonel Garrett's vital signs through the secure Army intelligence portal, a privilege Mercer didn't know she possessed, a digital lifeline that kept her tethered to her assignment even in the hours when she wasn't wearing scrubs. The moment his oxygen saturation began to plummet, she saw the numbers. Watched them cascade downward. 94, 87. 72, 58. Felt the weight of what Mercer had done settle into her bones like shrapnel. She was moving before conscious thought caught up, sweatpants, bare feet shoved into combat boots, her service pistol secured in the waistband of her jacket, keys already in her hand. 6 minutes. That was all the time she had. The ICU doors burst open at 0318. Rachel's boot struck the tile with the sound of someone who knew exactly where she was going. The code team was already there, our nurses, respiratory therapy, the attending, security beginning to gather, forming that tight cluster of controlled panic that surrounded a patient in collapse. She didn't slow down. Didn't apologize for being off duty. Didn't raise her voice. She simply moved to the bedside, scanned the monitors, looked at Patel's face, and said 3 words, "Open him here." Patel's jaw tightened. He won't survive transport, but he'll survive a field procedure even less. I can't authorize. You don't have to. Rachel was already pulling on sterile gloves with her teeth, stripping them off as they tore, reaching for a fresh pair with movements that belonged to someone who'd dressed for surgery in sandstorms and under mortar fire. I will. Dr. Mercer appeared in the doorway then, as if summoned by the disruption of his carefully engineered outcome. His face transformed through several expressions in quick succession: confusion, anger, then a kind of cold certainty that told Rachel everything she needed to know about what he'd done. Nurse Torres, you are not on duty. You are not authorized to participate in this code. Security, remove her immediately. Rachel locked the trauma room door. The click of the deadbolt was small but absolute. Mercer's pounding began 3 seconds later, a furious staccato against reinforced glass. Open this door. You're violating every protocol in this hospital. I'm calling the state nursing board. You'll never work in medicine again. His voice cracked on the last word. She didn't look at him. A scalpel lay on the sterile field. She picked it up, steadied her breathing the way they'd taught her in the 75th Ranger Regiment trauma course, in through the nose, out through the mouth, center yourself in the chaos, and made the incision. Left anterior chest wall, just below the 4th rib. The blade moved through skin and subcutaneous tissue with the kind of precision that only came from having done this before in places where precision meant keeping someone alive long enough to get them out of the kill zone. Blood welled up immediately. She called for suction without emotion in her voice. Martinez, rib spreader. The surgical tech appeared at her right shoulder as if he'd been waiting for exactly this moment, bypassing security, moving past Mercer's legal threats like a man who'd made his own choice about who to follow. He placed the stainless steel spreader into her hands and she positioned it between the ribs, felt the resistance as she began to open the chest cavity. The spreading metal separated bone with a sensation like cracking ice, sharp, definitive, the kind of sound that meant there was no going back. Blood poured out. She called for clamps. For suction. Her hands moved through a dozen firefights in the Hindu Kush, muscle memory translating into action. Every procedure conducted on men bleeding out while rounds snapped overhead now applied to a single patient in a climate-controlled trauma room. The pseudoaneurysm was visible immediately, a bulging sac of compromised arterial wall leaking dark blood into the thoracic cavity. She could see where it had ruptured, the edges ragged and unraveling. She positioned her gloved fingers around the subclavian artery proximal to the injury, applied direct pressure, and felt the bleeding slow. I need a vascular clamp. Satin sky if you have it. I have it, Martinez said. His voice was steady. He placed it into her hands and she applied it with the kind of care that existed somewhere between gentleness and absolute authority. The bleeding stopped. She looked at the chest full of blood, at the damaged vessel, at the monitor showing a heart rate that had been climbing toward 140 and was now beginning to slow. Stabilizing. Get me packed red cells. Type O negative. I'm going to need to repair this before we get him to the OR. Mercer's pounding had stopped. Through the glass, she could see him staring, his face the color of old bone, his mouth working around words that didn't come. His hand was at his phone. She caught his eye for exactly 1 second, long enough for him to understand that she knew what he'd done, that she'd already documented it, that his carefully constructed network of lies was about to collapse in ways he couldn't yet comprehend. Then she turned back to the bleeding subclavian artery and began the work of saving the Colonel's life. 23 minutes later, Colonel Garrett's bleeding was controlled. His chest was packed, his pressure climbing toward something survivable. The heart monitor showed a steady sinus rhythm. She called for a stretcher, for transport to the OR, for vascular surgery to meet them there. As the code team rushed him out, moving with the kind of coordinated precision that came from knowing they were now fighting to save a life instead of managing a death, Rachel stripped off her gloves, stepped back from the trauma bed, and became very still. Her sweatpants were soaked with blood. Her boots left red prints on the tile. Her hands trembled, not from fear, but from the deceleration of adrenaline, her body finally catching up to the fact that she'd just performed emergency thoracic surgery in a hospital trauma room without authorization, without privileges, without anything except the absolute certainty that if she didn't act, a man would die. She needed coffee. She needed to sit down. She needed to file a report that nobody would ever see. Instead, she unlocked the trauma room door just as security arrived, and surrendered her badge without being asked. By 0800, 3 separate events had triggered consequences that would reshape everything. First, Colonel Garrett was already in definitive vascular repair with 2 attending surgeons, his condition upgraded to guarded but stable. Second, a state nursing investigator had arrived at St. Michael's administrator's office with a briefcase full of evidence, not about Rachel, but about Dr. Mercer. Years of phantom billing. Fabricated surgical consultations. Coordinated fraud with insurance companies that added up to something in the neighborhood of $870,000. Third, a courier had delivered an envelope to Rachel's apartment while she was still at the hospital. When she finally arrived home at 15:45, still wearing her bloodstained scrubs because nothing else had felt important enough to change into, the envelope was waiting on her kitchen table alongside a handwritten note, effective immediately. Your contract with St. Michael's Medical Center has been terminated for violation of nursing standards, unauthorized practice of medicine, and breach of hospital protocol. You are not permitted on hospital grounds. Rachel stood in her kitchen, reading the letter for the second time, understanding with perfect clarity that she couldn't defend herself without revealing her assignment, couldn't explain what she'd done without exposing the classified operation she'd been sent to protect. The mission came first. The mission always came first. She set the letter down and sat in the chair where her daughter would find her at 1600, where Maya would tug her sleeve and ask why Mommy was home, why she was crying, why her scrub smelled like hospitals and fear. By morning, the calls had started. Board members received them at home, voice calm, professional, devastating. Dr. Mercer described Rachel Torres as unstable, potentially dangerous, a temp nurse practicing medicine without a license, performing procedures she had no authority to perform. One call went to the hospital's risk management director. Another to the chief medical officer. A third to the board chair, a man who'd known Mercer for 15 years and trusted his judgment implicitly. The narrative was precise, a rogue operator who'd locked a trauma room door and performed unauthorized surgery. He didn't mention his own absence. He didn't mention the deleted chart. He only mentioned her violation, her recklessness, her threat to the institution's liability insurance. The state nursing investigator arrived at 0800, walking through St. Michael's lobby with a leather briefcase that looked heavier than it actually was. Inside were fabricated complaints, signatures forged from patients Rachel had never cared for, allegations of medication errors that never occurred, reports of unprofessional conduct submitted by staff members who'd actually watched her work with the precision of a surgeon. The investigator, a woman named Hartley who'd been doing this job for 12 years, climbed to the ICU and found Rachel at the med station. She didn't smile. "Captain Torres, I need to speak with you about a formal investigation." Rachel's hands didn't shake. Her voice didn't waver. "Of course." But in that moment, something shifted behind her eyes, the realization that this wasn't incompetence. This was coordinated. This was lethal. The termination letter arrived by courier at 1415 hours. Rachel was home by then, still in civilian clothes, still moving like someone whose body hadn't yet caught up with the fact that her cover assignment had collapsed. She sat at the kitchen table and read the hospital's official language, violation of nursing protocols. Unauthorized medical intervention. Breach of patient confidentiality. Effective immediately. Her hands were steady as she set the letter down. The rain had started outside, that kind of Denver rain that sounds like applause on window panes, like the sky was congratulating itself for drowning everything below. At 1600 exactly, a small hand tugged her sleeve. Maya was 7 years old with her mother's eyes and her mother's ability to sense danger. "Mommy, why are you home? Did something bad happen?" Rachel's jaw tightened. She wanted to say the words, that her commander had embedded her at St. Michael's 3 months ago to monitor Colonel Garrett, a Green Beret carrying classified information about a compromised operation in the Hindu Kush, intelligence so sensitive that blowing her cover meant not just job loss but mission failure and leaving him defenseless. She wanted to explain why she couldn't fight back, couldn't defend herself, couldn't tell the truth about why she'd locked that trauma room door or what she'd been trained to do under fire. Instead, she pulled Maya into her lap. "Mommy's job is over. We're going to be okay." It was the only truth she could tell. Her phone rang at 2,247 hours. Unknown number. She answered anyway. Her commander's voice came through like a ghost transmission. "The Pentagon has authorized federal intervention. Military personnel will be en route within 72 hours. You are to remain silent. Tell no one. Colonel Garrett is being transferred to military protective custody." Rachel closed her eyes. "Understood, sir." The line went dead. She looked at the faded unit patch hanging on her bedroom mirror, the green beret insignia she'd sewn into her jacket lining months ago, touching it each morning like a prayer. Tomorrow, it would come out of hiding. 72 hours arrived like clockwork. 2 MPs in dress uniform, pressed creases sharp enough to cut, boots polished to mirrors, escorted Rachel through St. Michael's security at 0930 hours on a Friday. The ICU fell silent as they walked. Nurses looked up from med stations. Doctors paused mid-conversation. Nobody stopped them. The MPs moved with the quiet authority of men who weren't asking permission. In the ICU, Colonel Garrett lay in his bed still processing the previous 72 hours, the military guards who'd appeared, the federal agents who'd taken his chart, the sudden shift from a dying man nobody cared about to something worth protecting. His eyes were open. Awake. Focused. When Rachel stepped into the room, those eyes locked onto her face and held. His breathing tube had been removed 12 hours prior. His voice came out raw but clear, shaped by muscle memory and recognition, Reaper. Her call sign. The name she'd earned in Cunha province 6 years ago when she dragged a Delta operator out of a mortar barrage with her own body. The name nobody at St. Michael's knew. The name that meant she wasn't just a nurse, she was a soldier. The hospital administrator walked in next, reading from an official document with his voice carrying the weight of ceremony. Captain Rachel Torres, Bronze Star with Valor for heroic service under fire. 16 combat deployments. Rachel's composure didn't crack, but her hand moved instinctively to the unit patch she'd pulled from hiding and pinned to her chest that morning, the same patch she'd been touching in secret for 90 days. A Marine colonel in dress blue stepped forward and continued reading, his voice steady as artillery fire. Silver Star for actions in Cunha province, where she performed field surgery on for critically wounded operators under sustained enemy fire. Another pause. The room's oxygen seemed to thin. 2 purple hearts. Recognition for service above and beyond the call of duty. That's when Dr. Mercer burst through the door, his face flushed red with panic and rage. "This is illegal. She's not a licensed. She performed unauthorized procedures. I have documentation of her recklessness." His words came in a rush, desperate, untethered. But he stopped speaking when a 2-star general stepped forward from the back of the room, a man whose presence moved the air like a tank idling in a garage. The general came to attention. His arm rose. He saluted, not the colonel in the bed, but the captain in scrubs. His voice carved through the room like a blade. "Your decorations speak louder than any nursing license." A Pentagon liaison stepped to the center of the ICU, flanked by 2 FBI agents in dark jackets. His voice was pitch-perfect professional, cutting through Mercer's sputtering denials like a scalpel through tissue. "Captain Torres has been operating under classified orders. This hospital has been under federal investigation for 90 days. He turned to face Mercer directly. "We need to discuss your after-hours billing practices, Doctor." The FBI agents moved toward Mercer. He backed up, his hands raised, and someone in the room heard him actually say, "I can explain," as if explanation were still possible. As if he'd thought any of this through to its end. One agent began reading rights, "You have the right to remain silent," but Mercer kept talking anyway, the way guilty people do when they're drowning, as if words could reverse what numbers couldn't. There were clerical errors, the coding team, I didn't. The agent's voice cut him off like a door slamming. "We have 18 months of documentation. You've defrauded Medicare, Medicaid, and private insurers for approximately $2.3 million. Then a quiet man stepped forward, Chen, the IT specialist who'd worked nights in the hospital's server room. Rachel had nodded to him each morning in the hallway, a small gesture that a Navy corpsman would recognize as acknowledgement from one soldier to another. Chen carried a laptop like it was sacred. Dr. Mercer attempted to delete security footage from the last 90 days. Patient rooms. Medication dispensaries. After-hours procedure suites. Chen's voice had the flatness of someone who'd seen worse than this in deployments. I backed it up to federal servers in real time. Reported the deletion attempts to the FBI task force Captain Torres was feeding information to. The footage played on a wall-mounted monitor. Mercer at midnight with his specialists, people who never existed in the medical record. Phantom consultations. Comatose patients. Altered charts. Mercer's own hand, visible on security video, coaching staff on how to document services never provided. The room watched in silence so thick you could operate in it. Within 4 hours, Mercer's entire network had collapsed. Board members received calls from the FBI. The state investigator tore up her fabricated complaints and issued a formal apology. His lawyer arrived by 1500 hours. The hospital suspended him pending criminal investigation. As FBI agents walked him toward the elevator, Mercer passed Rachel in the hallway. His voice dropped to a hiss, "You destroyed my career." Rachel took one measured breath. Her hand rested on the unit patch now displayed openly on her jacket. When she spoke, her voice was perfectly calm, the kind of calm that comes from having already survived the worst. "No, Doctor. You destroyed it. I just documented it." The silence that followed wasn't the silence of shock. It was the silence of finality. The silence of someone understanding, with absolute clarity, that they'd crossed a line they could never step back from. Colonel Garrett watched from his bed, a man who'd served alongside women and men like Rachel for 23 years and understood that she'd just earned something that no medal could grant, permission to stop hiding. Within the hour, military transport arrived to move him to Walter Reed. Rachel would transfer to the VA hospital in Denver within 6 months, promoted to Chief of Trauma Services. The only medical officer Colonel Garrett fully trusted would be the one who'd locked a trauma room door and refused to let him die. Your stories matter. The quiet ones. The hidden ones. The people you overlook deserve recognition too. If you've ever been underestimated by someone who didn't know your true value, subscribe now. Share this video with someone who needs to hear that their service, visible or invisible, matters.